morning, Boris Johnson has repeatedly dismissed calls for an official inquiry into the conduct of his top adviser, Dominic Cummings. The Prime Minister was put on the spot by a committee of senior MPs and asked to authorise a formal investigation into why Mr Cummings drove his family hundreds of miles during the lockdown. Mr Johnson said he understood public indignation, but said that the outcry was just a political ding-dong. More Conservative MPs have come forward today to demand Mr Cummings' resignation, despite the Prime Minister's appeals for everyone to move on and to focus on the new contact tracing system to fight the pandemic, which is being launched tomorrow in England and in Scotland, where they have their own system. The latest official figures show that the total number of deaths across the UK is now 37,460, and there were 412 deaths recorded in the last 24-hour period. Mr Johnson's appearance before that committee was hardly plain sailing, as our political editor Laura Kunsberg tells us.
You think the public will believe you?
He is the Prime Minister's top adviser. It's been the Prime Minister's choice to keep him on. The Prime Minister who's had Dominic Cummings by his side. So today it was for the Prime Minister to defend their decisions to MPs.
Have you had a look at your inbox? My inbox, like MPs across the UK, is filled with people listing their sacrifices. He won't say sorry. Will you say sorry on his behalf?
I am sorry for the pain, as I say, the anguish and the heartbreak of so many people in this country.
What about Mr Cummings' journey confusing other parents?
The reason you're not giving people a straight answer is because you are trying to protect Dominic Cummings. 40,000 people are dead. We need you to get this right now. So can you tell us, you have a choice between protecting Dominic Cummings and putting the national interest first. Which will it be, Prime Minister?
Well, I think my choice is the choice that the British people will want us all to make, Yvette, and that is, as far as we possibly can, to lay aside party political point scoring and to put the national interest first.
This is now a distraction. People are very annoyed, Prime Minister. Is that on your radar?
I do understand why people feel such indignation about the whole business and the pain of the whole business of the lockdown. But I really also think that what they want now is for us to focus on them.
But the Prime Minister was also pressed on the country's halting start to testing for the virus and plans for a huge tracing system starting tomorrow.
Why it took until April to introduce the 100,000 test target, even though our first confirmed case was in January.
The brutal reality, Jeremy, is that this country did not learn the lessons of SARS or MERS, and we didn't have a test operation ready to go on the scale that we needed.
But from tomorrow, thousands of people in England could be asked to stay at home if they've been in contact with anyone with the virus.
But is it compulsory or is it advisory?
We intend to make it absolutely clear to people that they must stay at home.
Is it a law or is it advice?
We will be asking people to stay at home. That captivity for a tiny minority for a short time will allow us gradually to release 66 million people from the current situation.
Why, he was asked, quarantine people flying into the UK soon, when at the start of the virus, the government allowed planes to keep going to and fro.
Why now, when we're easing the lockdown and other countries are ending quarantine? And why not when we entered into lockdown?
Because the scientific advice was very clear that it would make no difference to the arrival of the epidemic. What we don't want to see is reinfection from abroad, and we think a sensible quarantine scheme can help.
And then an awkward question about who holds the Prime Minister's attention.
You made the distinction between there being a lot of women and enough women. How many is enough?
Oh boy, this is that's a question on which I'm not competent to pronounce.
Is it not 50%?
It's not a joking matter, though, is it?
It's not, and all I say, Caroline, is that it's incredibly important to us, as Conservatives.
But this afternoon was dominated by questions about the Prime Minister's adviser. Again and again, Boris Johnson said he wanted to move on. But even as he was speaking, there were more calls from Tory MPs for Mr Cummings to say sorry or quit. So even in the Prime Minister's own political party, upset hasn't faded. Not yet. clearing things up is not straightforward, but Number 10 believes toughing it out will see them through. Laura Kunsberg, BBC News, Westminster.
Now, the Health Secretary, Matt Hancock, says the rollout of the Test and Trace scheme in England tomorrow is an important milestone and declared it was everyone's civic duty to cooperate. He said those who've been in contact with people showing symptoms of COVID-19 will be told to self-isolate even if they themselves do not have symptoms. Northern Ireland has its own version up and running. Scotland has announced its own system will also start tomorrow, and Wales' system is due to start in early June. Our health editor Hugh Pym has more details.
It's billed as a new phase in the battle to contain the virus, targeting people at risk and the areas where they live, so restrictions for others can be progressively eased. It'll be a big ask for some. Those who've recently met up with someone who tested positive will be told to self-isolate for 2 weeks.
NHS Test and Trace means we can start to replace the national lockdown with individual isolation for those who've been in contact with the virus and local action where it's necessary to respond to a flare-up.
A local tracing system's already been tried out in Sheffield. Volunteers got in touch with individuals who'd recently been in contact with people who had the virus, and it wasn't always easy.
All you're saying to people is isolate, don't go to work, maybe don't earn. They're difficult things to say, and there isn't, if you're making people anxious, they might get the illness. So that piece is hard.
So will people self-isolate if they're asked to?
I guess there's a risk that some of your civil liberties are being infringed, but in the immediate instance, you've got to stay safe for the benefit of you and everyone around you.
I'd probably initially be a bit scared, but I would be happy to isolate for 14 days.
Here's how it works. If you have coronavirus symptoms, you self-isolate and book yourself a test. If it's positive, an official will call and discuss your recent contacts. Anyone you've been 2 metres or less from for more than 15 minutes, or closer than 1 metre face-to-face. So that could be colleagues in the office or friends you may have seen. The tracers then call these people and tell them to self-isolate for up to 14 days, though ultimately it's voluntary. A smartphone app to help the process has been tried out but is not yet ready to be officially launched. So will the scheme work? Some are cautious about how it might turn out in practice.
It is a big undertaking, and the huge challenge is to link up the testing and tracing people with your carers, the local GPs and the local public health system. But if we get it right, then it provides us with a fantastic community shield.
Test results need to come back quickly, but Pauline, who was tested on Tuesday last week at a drive-in centre like this, still hasn't heard.
8 days later, I have still not received a result, and I'm feeling very anxious. I'm just wondering when I'm going to get the text message to tell me.
The Scottish Government's Test and Protect strategy will also be launched tomorrow. A scheme in Wales is set to start on Monday. Northern Ireland's got underway last week. The aim is always the same: search out those who might be infected, get them to self-isolate and hopefully contain the virus.
And Hugh is with me now. Let's talk about this track and trace regime as explained by Matt Hancock today. It is asking quite a lot of people, isn't it?
Yes, Hugh, people are going to have to expect quite big changes, potentially. First of all, if you develop symptoms, you are expected to book a test online, get it done. And if you test positive, you'll then be told to go onto a government website and put in details of your recent contacts, people you've met up with, their phone numbers, their email addresses. Now, that may well raise a few concerns. NHS leaders have gone out of their way to say data confidentiality will be absolutely crucial here. That's what happens in the NHS, and it will be observed. Then there's this other group of people who may be perfectly fit and well without any symptoms, who get a call or an email saying that they've been in contact with someone who's tested positive. They will have to self-isolate for 14 days. They will be expected to do that. And ministers have not ruled out potentially if this is the last resort, financial penalties. That's quite a lot for people to get used to. So is it going to work? Well, the infrastructure all seems to be there, but it really depends on test results coming back quickly. And as we heard there, some people have been waiting several days. The app, the contact tracing app that was much talked about, that still hasn't been into a position where it can be rolled out nationally. It's still being tried out. So there's been a broad welcome for all this. It's seen as a crucial way forward to try to chart a way through raising lockdown restrictions. But a lot of questions still over whether it really can be delivered.
Hugh, once again, thanks very much. Hugh Pym there, our health editor.